Thank you so much, Rani, for speaking to our hearts. Social distancing, social isolation, shelter in place are new concepts to us, and they are some of the things that can work against our well being. While they are good for our physical health, they challenge our mental health in a time of crisis. For those of us who already live with a diagnosis of mental illness or mental disorder, we recommend in this time that you follow your usual protocol. If you have medication to take, you do that. If you do any type of intervention to help you to stay calm and relaxed, that's what you do. If you need to see the doctor at this time, please do. But all of us have to manage our mental health and well being in this time. I would like to make some suggestions as to what we can do. First, deal with difficult emotions. These are times of challenging thoughts and challenging emotions. And these emotions are different from what we are accustomed to, different from how we think on a day to day basis. Find someone with whom you're comfortable and speak about them. Be open. If you have access to talk therapy or psychotherapy, then it's definitely recommended that you do it. What you can also do, you can keep a diary. I call them the mood diary or the emotion diary. And you keep a diary of your mood and emotions daily. Record the things that are difficult and challenging. And two things. One, God sees them. And two, on another opportunity or at another time, you can share them with someone who possibly can help you manage your well being. Secondly, we seem to be perfecting social distancing. I'd like to recommend social media distancing. I'm doing this because I feel like sometimes our intake of news and information works against our best well being. Take news and information on the virus in small portions. You do not need to know all the deaths, all the damage, all the injury and havoc that COVID-19 is causing globally. Use the tools that your phone provides you with for snoozing, for unfollowing, and even for setting time and time limits on your apps. In your mobile phone settings, there is a digital well-being aspect. I use this to control how much time I will spend each day on any app that I subscribe to. It shuts me out when my time limit has been reached. And finally, employ something that relaxes you and that may be meditative to you. Art, for some people, working puzzles, even cooking can be an intervention for this time. I like singing. As Christians, we have hymns of great promises. When I am anxious, whether I am depressed or whether I'm happy, great is thy faithfulness, O God my Father, brings me the most amount of calm and takes care of every emotion. I hope these brief suggestions meet your heart well as we fiercely guard our mental health and well being during this crisis.